with lakhs of people getting infected and thousands dying daily due to COVID in the second wave in India, my advice to the general public is to wear a mask, avoid going out of the house unless and until really needed. Get yourself vaccinated, irrespective of the type of vaccine available, and remove the thought from your mind that one gets COVID from the vaccine. Vaccine does not cause COVID. This time the coronavirus is more virulent and much more contagious. It is infecting the younger generations as compared to the older generation in the first wave. The younger people are getting more infected, they are getting more serious lung disease, they are getting hospitalized and need more oxygen therapy. This time the deaths are much more seen in the younger generations. Once positive, one needs to isolate himself and ask for a home quarantine and start the medicines as provided by the government, which is provided free of cost. And during the first 5 days of this infection, one needs to hydrate himself very well and keep a watch on the oxygen saturation. Very important tool during the course of COVID infection is monitoring is oxygen saturation. There's something called a 6-minute walk test. Take the oxygen saturation, which is also known as SpO2, at the baseline, which should be 95% and above, and ask the person to walk on a level ground for a period of 6 minutes. At the end of 6 minutes, measure the oxygen saturation again. If it is less than 93% or it's dropped more than 3%, then it is significant. One needs to contact his doctor immediately. CT scan and steroids need to be avoided during the first 5 days of the infection. Once infected, people usually advise for CT scan. This needs to be avoided, and most of the time the scan will be normal at this time. CT scan has to be done between the 5th and the 8th day, or if the patient has got high-grade fever, patient is symptomatic, patient has got a lot of cough, patient has got breathing problem, then CT scan has to be done on a priority. Steroids are not to be started during the first 5 days of the therapy, as the virus is multiplying during this period of time. If started during this period of time, the steroids causes more harm rather than benefit to the patient, and steroids themselves has got long-term side effects. 85 to 90% of the patients are asymptomatic and they don't need any treatment at all. They can be confined only at the home isolation. As per the new guidelines which is issued by the government of India, one need not do a retest after the end of the 10 days. At the end of 10 days of home isolation, or from the 10 days of the day the test was sent for sampling, one can join work on the 11th day. No repeat testing has to be done. Thank you. Take care and stay safe.